Namaskar, I'm Ashok Vyas, and I have the distinct pleasure and honor of welcoming someone who is paying attention to how our mind is functioning, and not only paying attention, but he's also helping people come out of the stress. And this is a very specialized branch of knowledge which we refer to as psychiatry. So the gentleman who you soon are going to meet is a board certified geriatric psychiatrist, and he is currently working as unit director inpatient psychiatry at Maimonides Medical Center in Brooklyn, New York, and there is much more that we will learn about him. But I also want to mention that he did fellowship in geriatric psychiatry from Columbia University, and with exact, or rather the numeric 9 is considered as a complete numeric. So this guy has a 9 years experience and brings a sense of completeness with him. First, I take this opportunity to welcome you and thank you, Dr. Arnabh ji, for joining us.
Thank you very much, Mr. Vyas.
Mind is such a fascinating, call that instrument or the controlling organ that we have in human body, and each mind functions differently. So as a psychiatrist, what your research has taught you, and I come to the current situation, have you found mind functioning differently because of the impact of COVID-19?
So I think what you're asking is how stress has affected people's thinking at this time, how it has affected our mind per se. So I think it's important to differentiate that not all stress is bad, that actually we do need certain amount of stress on a day-to-day basis to get our day started, to even have a reason to get up, right? In the morning we need to have certain goals and targets that we would like to set for ourselves.
So forgive me, when you say you need some reason to get up, etc., and we were talking about stress, so you would wake up and you would become active without any stress also, or not?
So you would be able to do that initially, but imagine your life on a beach all the time. How long can you actually live there without having any clear goals? Your life cannot be a vacation all the time. So what I'm trying to say is that a certain amount of stress is actually healthy for the body, healthy for the brain. But situations like the current pandemic are they're globally prevalent. It's in the news all the time. And now we have reached a point where the stress is no longer what is beneficial. It is now affecting everybody. It is affecting a lot of people very negatively. I feel there are two main psychological themes that are at play here in dealing with the stress that comes from the coronavirus pandemic. One of them is our need or our desire to be able to control everything in our lives and to feel that we are the masters of everything that happens in our life. So if you think about it, even a small little thing like a traffic accident on the way to work can really upset our day and can throw us out of gear.
Absolutely.
To balance that, we have to have another psychological theme which I think is existing right now, is that those who live better with uncertainty, who do better in periods of stress like this, who do better, they are usually the ones who have the ability to live with uncertainty. So I think it is an interplay between these two themes, where those who feel like things are immediately out of their control will tend to start having more psychological problems, while those who have more higher functioning, they tend to be able to understand that, okay, the pandemic has been with us for 6 months now, that it's not going to go away anytime soon, that we may actually need to continue to do social distancing and so on for the next year, maybe even longer. I think those who understand that the stress is going to be for a long period of time tend to do better. I think this interplay, this balance between the two is very important. And so far, I think like a good way to look at the amount of research that has come. So this current pandemic is quite new. There is a lot of research that is already coming, but I think the best way to understand it would be to look back in history, and that can help us understand how we dealt with situations like this before. So we have not had a global worldwide pandemic like this for many years, But in 2002, there was the SARS pandemic, which began in China, and it spread to 32 countries. It was a little lesser than this, but at that time, what happened was that it was more, it was not as infective as the current coronavirus pandemic, but it was more, the mortality rates were higher. So more people who got the infection actually succumbed to the infection. And at that time, there's a lot of research that was done to see what the psychological impacts were at that time. And they realized that there was an increase in what we call post-traumatic stress disorder, acute stress disorders, also increases in depression. And overall, in the general public, especially in countries like China and Canada, which were most affected, there was in general a lot of negative mental health outcomes. There was a lot of what we call health-seeking behaviors, meaning calling your doctor multiple times, little things like that, there was a lot of increase in that. The good thing that we learned also from the previous pandemic, was that very soon, within 6 months to a year after the pandemic actually finishing, these many people actually got better. Not everybody who started experiencing symptoms were the ones who needed long-term psychiatric treatment and so on. So that was actually one good thing that we did learn from it.
Okay, so now you talked about research on this, and also you beautifully gave us the way to compare difference in people's perception of how to cope up with uncertainty, and there are some people who are better equipped.
Mm-hmm.
So how to be that person who is better equipped
Right.
to sort of accept uncertainty? Is there any tip that you can offer?
So, I think the best way to conceptualize this is to think that all our emotions, all our feelings, all our fears, all our behaviors, we generally ascribe it all to the mind. Right? That everything is coming from the mind, but we tend to forget that the mind is actually a product of the brain, and the brain is an organ, just like any other organ. It is made up of cells. The cells that mostly make up the brain are neurons or nerve cells, and there are like many billions of nerve cells that are there in the brain, and like every other organ in the body, it needs to be taken care of. So I think a good way to understand this, how to deal with the stress that comes with it, and this doesn't apply to only this pandemic. In general, these are basically, I think, lifelong exercises that we can do. But we must understand that since it's the brain, which is basically an organ, you need to take care of it. It needs nutrition, it needs regular rest, it needs exercise. And when I say exercise, I mean both physical exercise as well as emotional or psychological exercise, mental exercises, right? So when we refer to, I think the people who generally tend to develop more of an anxiety response during stressful situations often are using what we call the lower aspects of the brain, where the prefrontal lobes, the frontal lobes and the prefrontal cortex is the part of the brain which has evolved over many thousands of years, and that is what separates us from say lower animals. And it is the prefrontal cortex that helps us deal with difficult news. It helps us take stock of a situation, not react impulsively, not generate an anxiety response immediately, and helps us understand that, okay, this situation needs me to take a step back to analyze all the data, and then use that information appropriately to develop an appropriate response, a thought out, measured response. Those of us who tend to use our anxiety centers more, they're usually a little lower down in the brain. And in those individuals, that imbalance that we talked about earlier can happen more. So for us to be able to cope with it better, the answers actually are very simple. We know this, everybody who's watching will also probably know this. It is the fact that we have to actually do it. That is what is harder. It's very, yes, it actually literally is discipline that comes from actually doing it. So we are talking about to take care of the mind and the brain, we really need to give it adequate rest, make sure that we're getting a good night's sleep. You can think about it. If you have slept a little less, the next day your motor functions are slow, which means that, say, small hand movements, small dexterity movements, they are definitely affected. Your ability to focus is affected, and one of the main functions of the brain is to learn new information, and that gets affected. So stress as such can affect the mind and the brain simultaneously. In addition,
so allow me to interrupt. Many times we as laymen use brain and mind as interchangeable words, but the way you are saying, there is a clear-cut understanding, and I'm sure there is. You want to say something about it?
I was just wanting to say that the mind actually is our thoughts and emotions are products of neurons. They're shaped by our experiences previously and also some amount of genetic predisposition. But difficult experiences in our life can actually change the way the neurons function, and it can change the chemical messengers between neurons, and so it can change the way the overall brain functions, and then we can have negative experiences. So people who are struggling to deal with the stress that is coming from, say, the current pandemic or from any difficult life situation, sometimes you unfortunately or fortunately you may need treatment, which includes psychotherapy or medications, but for the most part, for people just generally making sure that we get enough rest, making sure that our diet is healthy. And when I say healthy, so we're talking about less processed foods, less foods that have very like anything that comes in a packet is usually not a very good thing. Anything that has high sugar content is often not very good. So whole grains, fruits and vegetables, home cooked meals, traditional meals, there's a lot of benefit that can come from that. In addition to that, exercise. So physical exercise at any age across the board for every individual is actually very important. From brisk walks, 30-minute walks every day, to cardio workouts or weightlifting, depending on whatever one would like to do. Some things, activities like swimming and so on, are very, very helpful in keeping the brain functioning. There's a lot of research that has already been done, a lot of it in New York actually, where they have shown that exercise can actually change the way we retain short-term memories, like memories from the last week are much stronger if we have exercised that week. So it's a very fascinating field as such. Coping with
I'm kind of thinking that how inspiring it is to hear this suggestion coming from Dr. Arnabh Basu. We always hear that it is good to walk, etc. But now we know it is not just important for our physical well-being, but it is also important for our mental well-being. So the senior population must be feeling some extra stress due to COVID-19?
I think unfortunately the entire pandemic, both medically and emotionally or psychologically, has affected the older populations the most. It's really sad because it has been in the news all the time that the biggest risk factor for being affected by coronavirus and even be like succumbing to coronavirus is age, and older people who have other multiple medical problems like high blood pressure, diabetes and so on. So that was that has been a difficult thing for a lot of older people to hear. So there was a lot of fear initially within the older patients that I have seen. But in addition to that, early on when there was talk of the economy being opened up, there was a lot of fear that the infections would spread, and there was some sense in the news that older people are not as valuable, that if it is mostly affecting older people, mostly people who are passing away are unfortunately older. So, but it doesn't matter because we have to keep the economy going. So there was a very negative sense that people carried, feeling that they were not valuable. Already they feel that they're a burden sometimes on them, on their spouses or their families. If they have certain needs that need to be met, then they feel like they were a double of a burden at this time. That is just one aspect. how it began with the older population. Later on, what started happening is that many people who they have certain needs that are required to be met. A lot of my patients that I see have what we call home health aides or home attendants, people who come home to kind of take them to doctor's appointments, take them to just out for their regular outings for the day. Many of them go to social clubs. None of these things could be done. Also, older adults often they like to have a structure to the day. They like to follow a regular routine which they have inculcated over the decades, and so this structure was suddenly disrupted. They could not go for any social clubs. If they say like activities like going for a walk or going for swimming or something like that, or going to a social club, suddenly nothing could be done, so they were at home. Many people had food delivered home through different delivery services, and that was not happening anymore. Many of them could not go to see their doctors regularly. So while they were being helped over the phone, it was a very difficult experience for them.
People cannot go out, so now here is online, which is another way. So maybe Dr. Arnabh Basu talking to a patient who is sitting at home through Skype or Zoom or whatever. How do you see it has different
applications,
effect,
right?
As compared to the person sitting in front of you in person?
So if it is actually a practice of telepsychiatry, or if it is actually a practice of telemedicine, it can be very effective, especially in this. So what we saw in New York State during the surge of the coronavirus, most clinics shut down and a lot of care was being delivered via telephone. But what we can anticipate very soon is that telepsychiatry or telemedicine as such, using video conferencing, can actually be a very, very effective way. And just to think that older people may not be able to do it, that is probably not true. If many people can learn very rapidly, like learn cell phone skills, learn certain simple applications, and it can be very effective. So early on there was a lot of criticism that telepsychiatry or even telemedicine overall, but specifically psychiatry, will not be as effective as one-on-one sessions where you're sitting in the same room with the same person and like providing advice or listening to problems and prescribing medications. Psychiatry as a field has lesser physical contact than most other fields, so actually it goes very hand in hand. And now there is new research which has come during the pandemic and also before that, where what we call randomized control trials. So randomized control trials are the gold standard of any therapeutic modality to see if it is effective compared to either a placebo or to another treatment form. And they're seeing that using psychotherapy or using psychiatric evaluations using telepsychiatry has been quite effective.
In general, we have a feeling that dementia is incorrigible. So if somebody is having dementia, then they should forget everything, is what, as a distant observer,
right,
I would say. Then if they don't remember anything, then how come depression can enter into that zone of mind which is not able to retain anything?
I see. So dementia often is not, especially the more common ones, like those associated with Alzheimer's or those associated with small strokes. After small strokes, people can have what we call vascular dementias, or people who have Parkinson's disease. There are various types of like neurocognitive disorders or dementias. So it doesn't just happen like this. It's over many years in some cases. So you can often appreciate the fact that you are losing some of your brain's capabilities, and that can be very distressing. So in the early phase, there is a very high risk of quite severe depressions. In addition, there can be, the brain can start making up false memories. So you may start believing things which are not true. And often it becomes a big problem at home, where a person starts believing that their family member is stealing from them, is hiding things that they misplace, or which they forgot they had kept in a certain place.
How to correct that?
Usually the best way, unfortunately we often have to use medications at some times to address some of them, especially if the behavior can be very dangerous. But if it's not that severe, then really the best way is through counseling, through having a lot of like warmth and affection towards the person, through
So let me interrupt you to sort of underline warmth and affection is also potentially powerful to offer some sort of a healing, especially
Absolutely.
for the mind. That is
Absolutely.
why they say that the more you were hugged as a child or if you were loved, then
Mhm.
it helps your whole upbringing. But now let us move to other side, which is your focus and on which you have done a lot of research and which is very, very important. And before coming to this, I recollect one word from Sanskrit, which is aparigraha. That is also one of the basic principle of Jainism, especially aparigraha, that do not accumulate stuff.
Too much. Okay.
But that is what marketing teaches you.
Uh-huh.
And then you have a lot of deals. So you feel that, oh, this is coming cheap, let me keep it, buy it. So you end up having a lot of stuff at home and very little space to move. That is what hoarding is, right?
Right. So I think you're referring to, so one of the focus of my research has been on the specific, like I was mentioning, older people. We're trying to identify ways to prevent risk from injury, and hoarding is one of those. It's very common in people with dementias, but hoarding effectively means excessive accumulation of different objects irrespective of their value. We may think that what the person is collecting is of no value to, it doesn't appear to have any value to us or to them, but it's very hard for them to part with it, and it can affect people at sometimes to the point where they are unable to live safely. So it becomes a psychological or a psychiatric disorder when it affects one's life, their relationship with others, or their ability to engage in, say, day-to-day activities, engage in occupational, like their occupational pursuits. Severe hoarding is probably not as common as as hoarding disorder itself. So in hoarding disorder, you would have about maybe 4 to 5% of the population suffers from that. But those with severe hoarding, you will see their house is absolutely cluttered. They can often have huge piles of newspapers, magazines, old paper cuttings, very unhygienic situations. They're the ones who are at risk for being evicted very often. It's a very common cause of accidental fires. And also it can affect one emotionally, because you know that you live in a certain situation and you cannot engage with anybody socially. So you hesitate to bring anybody home, so you live more secluded. It's often very commonly seen in older people, and it is a big risk of falls. It is a big risk of accidental injuries. It's commonly seen in Alzheimer's disease, but mostly people with hoarding do not want to discuss it, because they feel that all their possessions will be taken away. Even if they do agree, you build a very good relationship with them, and they agree to go through each article with you and decide, okay, this I can put away, this you can discard. Very soon.
So that sense of attachment with
Yes.
whatever they are holding on to is difficult to let go.
It's difficult, it's different with different people, but mostly people who do engage understand that it's a problem, and then they would want to get some help, but often the problem comes back. So they really have to stay with very consistent therapy, and medications are not very effective.
So Dr. Arnabh Basu, while I thank you for joining us today, and I understand research helps us in understanding human mind, and then also we seek solutions. So based on the way you have served here in New York after completing your fellowship in geriatric psychiatry from Columbia University, and all the research that has gone, as well as you have worked with patients. So what has been the most satisfying aspect of your journey so far as geriatric psychiatrist? Any moment where you felt that this gave you a sense of inner satisfaction that you could extend real help to someone?
So in general, the belief is that a lot of psychiatric disorders, either many people believe they don't exist, or they believe that they cannot be treated. So while I'm saying they may not be cured yet, there is definitely treatments. So like any physician, psychiatrists also have good experiences where the patients do very well. So we've had a lot of those. And in geriatrics, the one main focus is that you have to love stories. You have to be able to listen to the person's life story, gain some insights from them, and often they can help like us as well. Like we learn a lot from our patients on a day-to-day basis, so that is one of the most gratifying experiences. Like it's hard for somebody who's in their 70s to take advice from somebody who's much younger than them, so it's often we learn a lot from our patients as well.
And while you learn, it's in some subtle way changes something in them and brings them to a better perception of who they are.
I certainly hope so. In many cases we've had some good results.
So now, as we conclude, this has been eye-opener from the point of view of the research that has gone into study of stress due to COVID-19. And as we say goodbye to you with thanks, anything else that you would like to add? And I also recollect you mentioned that walking is good, or there are a couple of other focused attention that with discipline, if you do, then you save yourself from a lot of mental stress. So anything else you want to add?
I mean, I would just point out again that historically, evolutionarily, we have evolved compared to the previous generation of say animals with the front part of our brain. That makes us separate, that makes us different from the rest of literally every other species. And so if we are able to give that the nutrition that it needs, which includes exercise, sleep, meditation, or dhyan as we say, so that is extremely important, and it's a long held Eastern concept which is now part of psychotherapy in the West. So meditation is very, very commonly practiced now across the world. That is something that we can focus on. Good health, good nutrition. That way we are able to combat lifelong illnesses, like not just psychological illnesses, but a lot of medical illnesses as well.
Very, very good. Thank you very much, Dr. Arnabh Basu.
My pleasure.
So as I fold my hands, this has also become an important way of greeting across the globe now due to COVID-19, and of course a lot of old wisdom is coming back, as you mentioned, in the form of meditation. And
I agree.
I again feel that you also helped us appreciate the importance of affection and love, and that is mutual actually. If you offer love, you also receive and you experience love, and that helps you in feeling a sense of wholeness, and it heals. So on that note of harmony and healing, once again thanking with lots of good wishes to you, Dr. Arnabh Basu.
My pleasure.
And thanking you for joining us with lots and lots of good wishes, for taking good care of yourself today, tomorrow, and every day. Every day. This is Ashok Vyas.